Assalamu alaikum. Our discussion today will be about the back of thigh, and this topic is a continuation of our discussion about the anterior compartment of thigh. So in the back of thigh, to start with, cutaneous nerve supply to the back of thigh. This comes from posterior cutaneous nerve of thigh, which is a branch of sacral plexus, as it leaves the gluteal region by emerging from beneath the lower border of gluteus maximus muscle, and it descends on the back of thigh in the popliteal fossa. It pierces the deep fascia and ends by supplying the skin over that region. During its course, it gives numerous branches to the skin on the back of thigh and the upper part of the leg. Superficial veins in the back of thigh. Many small veins curves around the medial and lateral aspect of the thigh, and ultimately they will drain into the great saphenous vein. Superficial veins from the lower part of the back of thigh may join the small saphenous vein in the popliteal fossa. For the lymphatic drainage of the back of thigh, the skin and superficial fascia of the back of thigh drain up to the vertical group superficial inguinal lymph node. Now, content of the posterior fascial compartment of thigh. First, muscles, which are biceps femoris muscle, semitendinosus muscle, semimembranosus muscle, and a small part of the adductor magnus muscle, which called the hamstring part of adductor magnus muscle. All these four muscles may be named in another name, and they are called hamstring muscle. Blood supply of the back of thigh comes from branches of profunda femoris artery. Nerve supply is coming from sciatic nerve. Note: first, biceps femoris muscle receives its nerve supply from sciatic nerve. The long head of the muscle is innervated from tibial portion of sciatic nerve, whereas the short head of the muscle is innervated from common peroneal part of the sciatic nerve. Second, note that the hamstring part of adductor magnus muscle receives its nerve supply from the tibial portion of the sciatic nerve, whereas the adductor part of that muscle receives its nerve supply from obturator nerve. This means that the adductor magnus muscle has double nerve supply from two nerves, part from obturator nerve and a part from tibial portion of sciatic nerve. Third note, the semimembranosus muscle, as it inserted downward, it sent a fibrous expansion up and laterally, and this fibrous expansion has an important function, that it reinforces the capsule over the back of the knee joint. This expansion has a name called oblique popliteal ligament. In this figure, you can see the semitendinosus muscle, semimembranosus muscle, both of them are cut. Biceps femoris muscle also, it is cut. Deep to these muscles, this triangular muscle, which is the adductor magnus muscle, and this adductor magnus muscle, you can see it is composed of two parts, a large adductor part and a small hamstring part. In this figure, you can see biceps femoris muscle have been cut, semitendinosus muscle. This is a long muscle, take its name from its insertion, which is from a long tendinous structure. Deep to it, semimembranosus muscle, and you can see as it inserted medially, its fiber will expand laterally and upward in a horizontal pattern, and here it reinforces the posterior surface or posterior part of the capsule of the knee joint. This expansion has a name called oblique popliteal ligament. Now, blood supply of the posterior compartment of thigh. The four perforating branches of the profunda femoris artery provide a rich blood supply to this compartment. The venous drainage of the posterior compartment of thigh is drained into profunda femoris vein, which will drain greater part of blood from the compartment. The nerve supply to the posterior compartment of thigh. It comes from an important nerve called sciatic nerve. Sciatic nerve is a branch of sacral plexus, and it leaves the gluteal region as it descends in the midline of the thigh. Here it is covered posteriorly, or it is overlapped posteriorly by the adjacent margin of the muscle biceps femoris and muscle semimembranosus, and it lies on the posterior aspect of adductor magnus muscle. In the lower part or the lower third of thigh, it ends by dividing into its two terminal branches. One is called tibial part and the other is called common peroneal nerve. Sometimes sciatic nerve may divide into its two terminal part at a higher level in the upper part of thigh or in the gluteal region or even inside the pelvis. You can see this is the sciatic nerve as it descends on the back of thigh, and it terminates usually in the lower third of thigh by division into two terminal branches: lateral part called common peroneal nerve, medial part called tibial nerve. Branches of the sciatic nerve. First, tibial nerve is a terminal branch of the sciatic nerve, and it will enter the popliteal fossa. Second branch is the common peroneal nerve. Also, it is a terminal branch of sciatic nerve and enter the popliteal fossa on the lateral side of the tibial nerve. It gives muscular branches to biceps femoris muscle, semitendinosus, semimembranosus, and hamstring part of the adductor magnus muscle. Usually these branches arises from the tibial component of the sciatic nerve and runs medially to supply all these muscles. Thank you.